how do they do a Kegel? Because I think a lot of people do them wrong.
So many people do them wrong. This is actually supported in the research and could be doing the opposite of a Kegel, which is bearing down, which can actually make the issue worse. There's a couple different cues, and I tell people to practice different ones. I say, okay, sit up nice and tall in a chair, put your feet flat. I want a nice neutral spine, and just take a big, deep cleansing breath before you even start to help your muscles relax. And then inhale, but on the exhale, think about sucking up a smoothie with your vagina if you're a female. Like you want that squeeze and that lift. Or if you're a male, you can think about, you're sitting up nice and tall. Think about if you are walking into cold water and your testicles kind of start to draw up. I want you to think about that drawing up maneuver. You can also think about like stopping your urine stream and holding in gas. It's the front and the back pelvic floor muscles together. That's a Kegel contraction. What we see people do a lot is they squeeze their butts. Or they squeeze their thighs together. They curl their toes. I'm like, that's not going to help your pelvic floor. But it's really just a very subtle contraction, in fact, that you are kind of just gently drawing that pelvic floor up and in, but then also fully relaxing it afterwards.
Yeah, I think that's so important. I think people forget to like, oh, I've drawn it up. Now I got to let it go.
Let it go.
Let it go. And what are other exercises? I think people only hear about Kegels, right? But what are other exercises people can do to strengthen those muscles?
So the way to activate the muscles is by doing a pelvic floor contraction or Kegel, but you want to integrate that into other exercises. So if you go to the gym and you're doing squats, lunges, lifting weights, deadlifts, anything like that, you should pre-contract your pelvic floor muscles because you're about to load your body, right? And you want those muscles to be active to support against any changes in intra-abdominal pressure, but also to be active because as you load them, it's going to respond to that load. And so we want that activation of those muscles when you're loading it. About a year ago, I started doing strength training. Never in my life have I done it. And I'm so tuned in and conditioned to pre-contract with every squat, lunge, lift, that I feel my pelvic floor a year later so much stronger just from integrating that pre-contraction into my workout routines. You can do Kegels in isolation, which means like if you want to practice quick Kegel contractions where you contract and relax and do like 3 sets of 10. You can do longer hold endurance contractions where you hold for 5 or 10 seconds and then relax fully afterwards. We have 2 different types of muscle fibers and you want to work both types, the quick and the endurance. And then you can do it in different positions. You can do them in lying down, sitting, standing, walking. I think we're so conditioned to do like Kegels while we're sitting at a red light, but that's not typically where we leak or where we need these muscles to be active. It's when we're moving and functioning throughout our day.
I love that. Yeah, I tell people you need to understand how to do them and learn. Some people have very weak pelvic floors,
yes.
right? You've seen it, right? They can't do a flicker of contraction when you assess them. And so it's about, one, strengthening them to the point where you can do them when you're doing those activities. So I think there is value in doing them by yourself and then starting to incorporate them, like you said, when you need it. So for example, if you're someone who leaks, then you want to do them when you do activities like coughing, sneezing, lifting heavy things. You want to contract before you do the heavy activity, right?
And even something like coughing or sneezing, there's something called the knack, which you just contract before you cough or sneeze. Like turn those muscles on before you need them. And it may not work every time, but as you build up your muscle strength, you'll have more, ability to prevent leaks because you're using the muscle better and more effectively. So absolutely, you have to use the muscle when you need it.
What about for post-void dribble? I think guys, they hate after dribble. It is a very challenging issue because we don't have like here, take this pill and it's going to get better. Right? So what do you tell men for that issue?
They need to be relaxing their pelvic floor muscles to empty their bladder well. So most men pee in standing. I say if you're home, try to sit down and see if you feel like you empty better. Or if you're out in the community and you can't sit or you don't feel comfortable sitting, like place your hand against the wall and that can help your pelvic floor muscles relax a little bit better. Then I tell them to do a couple of Kegel contractions. So that can help just kind of close that urinary sphincter and expel any additional urine through the urethra, and then they can shake a little bit. I also teach them something called urethral milking, where they kind of on the underside of the scrotum kind of make a couple wave-like motions to help push any urine through, couple Kegel contractions, and then a shake.
Yeah, it does help for sure. Absolutely. And I think the other thing is those strengthening exercises can help propel ejaculate
Yes.
as well. We know that as you age, the projection velocity decreases. So like when you're younger, it's like 15 to 30 milliliters per second. And as you age above like 50, it goes down to like 5 to 10 milliliters per second. So people will naturally see a weakening of the stream of ejaculation, but they'll correlate it with a decrease in volume, when in actuality it's just that it's just not coming out as fast. And so that's another place where I think Kegel exercises can help.
Yeah, that's actually really interesting. And to your point, even about the post-void dribble later, it's like if you have a stronger contraction to expel that urine, it's going to help there too. So I think it's an excellent point where we don't, with aging, we have, weaker skeletal muscles, we have atrophy, we have decreasing connective tissue. All of that plays a role into how these muscles are functioning. So you do want to be proactive and thinking about, if I'm doing all of these other strengthening recommendations, I need to be thinking about my pelvic floor as well.
Absolutely. We've alluded to high tone pelvic floor, which is a condition where these muscles are over tight or over tense. And I think it is extremely under recognized. I tell my husband a lot about the patients I see, and he's a physical medicine rehabilitation doctor. And he's like, you are basically a PM&R doctor. He's like, all you diagnose like 90% of the time is high tone pelvic floor dysfunction. I was like, but it's that common. I mean, the patients coming to me often have concomitant high tone pelvic floor, meaning their muscles are tense or tight or not relaxing sufficiently or uncoordinated. And so I want to talk a little bit about what that is and how people can improve that.
These muscles are like any other muscle in your body. They can be weak, which is what we mostly hear about, but they can also be too tight or tense. So for example, I get really bad neck and shoulder pain from, being too stressed or hovering over my computer, and I get headaches. The same thing can happen in your pelvic floor muscles. And where we see this manifest is that, people can't relax their urine streams well. They have a hard time starting their urine streams. Their dribble is slow, it's weak, their stream is weak. They have a staccato stream, so often it's like their stream starting and stopping, or it's splayed in different directions. We see it with bowel movements as well. They have pencil thin stools, straining with bowel movements, or they have pain. A lot of those clusters of symptoms are typically associated with high tone pelvic floor. And that's a situation where you don't want to do Kegel contractions. You're going to be tightening a muscle that's already tight. The focus needs to be on relaxation. But this is hard. We can't see this muscle and just say, okay, relax, or we can't straighten our elbow and say, okay, my bicep is relaxed. We need to really learn where it's located and some tools and techniques to relax it. So the first thing I teach people is breathing. We talked about how breathing with your diaphragm, really opening up your rib cage like an umbrella, can help relax your pelvic floor. Then you also want to look at how they're sitting and standing during the day. Are they clenching when they're, sitting in traffic? Are they clenching when they're sitting in Zoom meetings? Are they delaying their urges, and that's causing more overactivity in their muscles? And then giving them tips and tools to decrease the tension. So this could be yoga poses. It could be stretches like, cat-cow or child pose or happy baby or a figure 4 stretch. Really releasing the hips and the pelvic floor muscles, getting more movement and blood flow to the muscles throughout the day. And there's even internal devices that you can use to massage the muscles. Like there's internal devices you can use called a therapy wand that looks like, kind of a curved finger, and it can release tension in the trigger points vaginally or rectally.
Yeah. I've had male patients, they're like, it's really hard to do a wand on yourself.
Yeah.
Yeah.
It is really hard.
So it may be useful to have a person, who's open to helping you with that. Because I think the other thing that people don't realize about particularly about pelvic floor physical therapy, I think other therapies people get it, but with pelvic floor physical therapy, it's not just what you do in the office with you, right?
Right.
It needs to continue when you go home.
Absolutely. Well, we're only seeing patients often once a week or once every other week. It's not your traditional PT where you're in the gym 2 to 3 times a week. So our goal is really to help you, but also to give you the tools to help yourself. Because when you have, say, overactivity, you're likely going to get back into that space when you're tense or you're traveling or you're
Right.
stressed out. So I want you to have a toolbox of tools at home to facilitate relaxation. It can be an internal wand. It can be a partner using their finger or the wand. And there's even medications. A lot of people actually use suppositories, whether it's a muscle relaxer or it's a CBD suppository or, different things to kind of help internally relax the muscles as well.
Yes. And I tell patients the suppositories are great, but they're Band-Aids. They're not fixing the underlying issue. So I think people do get benefit from them, but I think to realize you don't want to spend the rest of your life taking suppositories. We got to fix the issue.
And one of the things I actually say is like if you're having a hard time like inserting a wand or having a finger inserted, it's nice to use those suppositories before that therapy because that just helps give you a little window of relaxation, and then you can go ahead and try to do some internal work. But there's so much you can do externally. I mean, if I release people's hips and piriformis muscles and, hip rotators and do cupping on their abdomen or glutes, like you can get so much relaxation from peeling the outside of the onion that helps the inside of the onion. And that's really the approach I like to take. It's like, I don't want to see you and I'm just going to start doing internal work right away. I really want to look at the lifestyle factors, but also work on those outside muscles that could be contributing to the internal tension.
Right. So what are some other exercises? You mentioned some yoga poses, cat, cow, happy baby, child's pose. What are some other figure four? What are some other exercises people can do at home if they are suspecting they have a high tone pelvic floor?
So I think those are the first ones. If you are a person who works out and you do a lot of weight training or even Pilates or bar or cycling, I recommend doing relaxation after that as well, because you are tightening those muscles and kind of gripping, and we need to balance them because otherwise we just get up and walk away and we have that tension that's being maintained. So spend 5-10 minutes, and I have a bunch of videos on this too, but it's really about like releasing the hips, doing some breathing. So it could be a 5-minute yoga routine. It could be laying down on a mat and doing those stretches we just talked about, but also a deep squat, like kind of getting into that deep squat position can be helpful. That will relax the pelvic floor muscles. Doing a single knee chest stretch, that can help. Any of those things that really kind of get your knees above your hips and release the hips and the pelvic floor can be helpful.
Yeah, I love when I used to do spinning a lot. They always do the figure four on the bike afterwards. I was like, that's great. That's a great, like, it's, every Peloton class has that stretch at the end. And I was like, okay, good. They're thinking about the pelvic floor.
Right. And
unintentionally, probably.
Unintentionally, but it is helpful because even just that 1 or 2 minutes goes a long way. And so, I tell people, like, even before sex, if you tend to have tension, like, do some breathing and stretching beforehand to help relax your pelvic floor muscles. Or if you're going to go into a strengthening routine, do a little bit of stretching and breathing before to like get your muscles in the right zone, the right length tension state that we're looking for, and then do the workout. So it's really just about balance.
Absolutely. If you're like a yogi and you do yoga or you do Pilates, is that enough? Do you think that's enough for people to maintain healthy pelvic floor?
I think that if you don't have dysfunction, those things can be fine. But I think if you start having dysfunction, it's likely not enough. We actually see a lot of people who are like overly stretchy, and they tend to have more laxity in their tissues and their joints. And that actually is not optimal for pelvic floor health. Like, we want stability. We don't just want laxity. So I think that is something to take into account. But even, we mentioned doing that pre-contraction with weightlifting, but you can do it in yoga. If you're holding a pose, you should be drawing that pelvic floor up and in to help support your core. What I see a lot with Pilates is we're tightening our abs, but we're like neglecting our pelvic floor because we don't even know how to turn it on, or you're not being cued for it. So when somebody tells you to like draw in your core, it really should be that sucking up the smoothing maneuver. So it comes from the base, from the root, and then you can draw your abs in. Otherwise, we're just like overactivating our rectus muscles and our transverse abs, and our pelvic floor just turned off. So I think it's again about balance. But with Pilates, I tell people, like, do your relaxation work after. Get into that deep squat, get into that child's pose, really get those muscles relaxed after you've just been tightening them for an hour.
Do you think we can do harm if we're doing just localized ab work and we're not paying attention to our pelvic floor?
I think you can, especially because you need to engage those deep muscles before you engage your rectus muscles. So we've got layers to the abdominal wall. We've got these deep transverse abdominal muscles that co-contract with your pelvic floor, and those offer us a lot of stability. They support our spine. You've got your obliques, and then we've got these big six-pack muscles. Our workout routines, and we're vain people, is we want to focus on what the outside looks like. We want those strong abs that are really visible. But underneath that, those muscles may be so overactive that those internal deep muscles aren't firing well. So it's really about balancing and making sure that you're getting that deep root contraction before you just do a bunch of ab work.
Yeah, I actually remember I have one patient who has really strong abs, but because the muscles are so tense in his abs, it actually causes his bladder to become overactive because he doesn't know how to relax the ab muscles because it's been like so strong.
I see this a lot with women too, when they are doing like Pilates a lot or core work, in the postpartum population too. It's like their abs are like tight, but they're not strong. And then they don't know how to relax them. So, a lot of with anybody who's a kind of a fitness person, it's about that relaxation component too.
If you guys enjoyed this clip from the episode of the Rena Malik MD podcast, make sure to check out the full episode with Dr. Reardon right here.